Okay, here we go.
My name is Kai Bishop, and I am doing a G-tube med administration for nursing 2. Today is 2/28, February 28th of 2019. So start out with, I would kind of go in and I would tell the patient like what I'll be doing. So I would have told them that I would come, I would do a quick assessment, I would flush, I would end up flushing there, flushing the tube, and then I would I would administer each medication, flushing that a lot as well, and then going, and then assessing them again, and then leaving. So I have my medication here. I'm going to verify it. The doctor's orders. So we have Lasix, which is 40 milligrams. It's not expired. Lasix is a loop diuretic, which prevents the reabsorption of sodium and decreases the amount of fluids held in the body. Two pre-assessments for that would be weight and blood pressure. And then two side effects of that would be hypotension and electrolyte imbalance. Then we have, Cipro, which is also in date. It is 250, so that's good. Cipro is a fluoroquinolone. It attacks both gram-positive and gram-negative cells, and prevents cell division. Some pre-assessments, you could look at the culture and sensitivity, see if it's actually an effective antibiotic, and you could, antibiotic and completely lost what I was gonna say. I'll come back to that. Some side effects would be nausea, vomiting, diarrhea. I guess those are multiple side effects, but and then tendinitis is another major side effect of that. Metformin, is 50 milligrams, and that would be, it inhibits the production of glucose from the liver, or decreases that, and then it also increases the body's sensitivity to insulin. This is an ER medication though, so I won't be giving it through that. I would have to call the pharmacy to look for a different way to administer that. Its side effects would be same gastric issues, nausea, vomiting, diarrhea. Then also hypoglycemia. Pre-assessments would be blood sugar and CBC, because another side effect can be thrombocytopenia. Back to the Cipro, or is it the Lasix? I didn't say one. It was Cipro. Another pre-assessment could be looking for a fever, or you can check their white blood cells. And then the last medication is carvedilol, and it's a 6.25 milligrams, so that is correct as well, along with everything. So that would be a beta-adrenergic blocker. So it's going to block epinephrine, or block epinephrine. So it's going to decrease, or it's going to increase vasodilation, decrease cardiac output, and it's going to decrease peripheral resistance, which will in turn decrease the blood pressure. So pre-assessments would be heart rate and blood pressure, and then heart rate, blood pressure, and then side effects would be hypotension, orthostatic hypotension especially, and oh my gosh, I'm going blank again. Dysrhythmias. Sure. Okay, so I'll get started here. Okay, so I'm gonna go into the patient's room first. So here we go.
Come in.
Hi, Miss Eubanks. How are you today?
Oh, good. How are you?
I'm Kai. I'm your nurse. I'm here to give you some medications.
Okay.
Can you tell me your name and date of birth?
My name is Allison Eubanks, and my birthday is 4/25 of 90.
Okay, that's great. Can I see your armband real quick? Yeah, perfect. Okay, can I listen to your stomach real fast?
Sure.
Oh, okay.
I'm hungry.
Hmm?
I'm hungry.
Yeah. Mm-hmm. Great, that's fantastic. Also, I have a tongue depressor. Can I make sure that you have a guy? Yeah, good. Okay, perfect. So I'm gonna go ahead and get started here. Set that there. So I'm going to put on some gloves. Well, do hand hygiene first. Too much. Goes on. So I'm going to prepare the medication. I'm opening these and putting them properly into the cups without touching them. So I'm crushing these. putting 10 milliliters of water in each of these little cups here to dissolve the medication. These can hold water, can't they? I'm gonna, before I get started, I'm gonna raise the bed up. Raise the bed. Raise the head of your bed up as well. Get a little high. Okay, that's all on me. So, perfect. Okay. Okay, can I see your side here? I'm gonna put this down here. Keep it from getting wet. First, I'm gonna look and see if we have any, make sure that we have the correct placement. So I would take out, and if it gets above 150, I would not administer the medications. There we go. Okay, so I got return. And it's not more than 150, so that means I'm good. I would also check, I would get a sample of this and check with the pH to make sure that we're actually in the stomach with it and it has the acidity with it. And then since it's not more than 150, I can put it back into the stomach. Okay, so then I would remove the plunger. Okay. You can just tap it closer. Put that down. Okay. So first I'm gonna flush it. The orders were 10 before and 10 after, and then it'll be 10 in between each of the medications. There's 10. Run here. Being cautious not to let any hair get in. So I'm going to give the first medication. I should have asked if there were any allergies earlier, but do you have any allergies?
No.
Good.
Okay.
Then I would do another 2 milliliter flush in between. Okay, the second medication. And then third. Not bad. Okay. So now that I have that done there, I'm gonna go ahead. Be done with that. Have it taped off here. Sure. Remove the plunger, or remove the syringe. Close this back up here. Okay. Make sure we're clean. Okay. Are we comfortable?
Mm-hmm.
Good. So there is some possibility of like nausea, vomiting. So I need, if you like feel that at all or notice anything like that, just let me know.
Okay.
It could cause, like, that's a risk for aspiration, so I don't want you to, like, you know, it could block off your breathing patterns or anything like that. So
Okay.
if you have anything like that, just let me know.
Yes, sir.
Is there anything else I can get for you? Would you like any? No? Okay.
Good.
Definitely, I'm gonna put you down here. Are you comfortable about right there?
Mm-hmm. That's
Fine.
comfy. Can I have my pillow back?
Yeah, definitely. Here you go. And then here is your call line.
Yep. Got it.
And once again, call me if you need anything. And I hope you have a good day.
Thank you.
Thank you. Okay.
All right.
Okay.
Clean up your stuff.
Yeah, definitely.